If you're over 65 and you've been told that surgery is your only option for knee or hip pain, I need you to hear this first. The research tells a very different story. Multiple clinical trials published in the last decade have found that specific, targeted exercises produce outcomes comparable to surgery for the most common types of knee and hip pain in older adults, with none of the risks, none of the recovery time, and none of the complications. Today I'm walking you through the 3 movements that orthopedic doctors and physical therapists now recommend as a first-line treatment for knee and hip pain after 65. Each one is backed by clinical evidence, and each one addresses a specific mechanical reason why joints break down after 65. Stay with me, because I'll also explain what most people are doing instead that makes the pain worse over time. Welcome back. On this channel, we focus entirely on health after 60, because the medical decisions you face at this stage of life are different and the stakes are higher. Knee and hip pain are among the most common complaints in adults over 65. The most frequent diagnosis is osteoarthritis, the gradual breakdown of cartilage that cushions the joint. For decades, the standard pathway was predictable: pain medication, then injections, then surgery. Procedures that carry real risks: infection, blood clots, nerve damage, and a recovery that can stretch 6 months or longer. What has changed is the evidence. A landmark study in the New England Journal of Medicine found that physical therapy was just as effective as surgery for meniscal tears, one of the most common reasons people over 65 are referred for knee surgery. The medical community is slowly shifting toward exercise as a primary treatment rather than a last resort. The reason most patients don't hear about this is simple. A physical therapy session doesn't generate the same revenue as a surgical procedure. That's not cynicism, it's economics. And it means the burden of knowing falls on you. So let's go through the 3 movements. Movement number 1, the straight leg raise. This is the foundational exercise for knee pain after 65, and it's the first movement prescribed in virtually every evidence-based knee rehabilitation protocol. Here's why it works. The quadriceps, the large muscle group at the front of the thigh, is the primary stabilizer of the knee joint. When the quadriceps are strong, they absorb force that would otherwise be transmitted directly to the joint surface, reducing the mechanical stress that causes pain and cartilage breakdown. After 65, quadriceps strength declines significantly. Studies show that older adults lose up to 3% of muscle mass per year without targeted resistance training. That loss of support is one of the primary drivers of knee pain progression. The straight leg raise strengthens the quadriceps without putting any compressive load on the knee joint itself, which makes it safe even for people with significant arthritis or recent inflammation. How to do it? Lie flat on your back on a firm surface. Bend one knee with the foot flat on the floor. Keep the other leg straight. Tighten the quadriceps of the straight leg. You should feel the muscle engage above the kneecap, and slowly raise it to the height of the bent knee. Hold for 2 seconds at the top. Lower slowly. That's 1 repetition. Aim for 3 sets of 15 repetitions on each leg every day. The key is the slow, controlled lowering. The eccentric phase, the lowering portion, produces greater strength gains than the lifting phase, and is what makes this exercise clinically effective rather than just mechanically active. If you feel discomfort in the lower back, place a small rolled towel under the small of your back for support.
If the straight leg feels too easy within 2 weeks, which it will, add a light ankle weight of 1 to 2 pounds and progress from there. Movement number 2, the clamshell.
If knee pain is driven by quadriceps weakness, hip pain, and a significant portion of knee pain is driven by weakness in the hip abductors, specifically the gluteus medius, a muscle on the outer side of the hip that most people have never heard of and almost no one over 65 has adequately trained. The gluteus medius controls the lateral stability of the pelvis. Every time you take a step, it fires to prevent your hip from dropping to the opposite side. When it's weak, which it almost always is in people with hip or knee pain, the pelvis tilts with each step, increasing the load on the inner knee and the hip joint itself. This creates a mechanical chain reaction that accelerates cartilage wear and drives the chronic pain cycle. The clamshell directly targets the gluteus medius with no spinal loading and no joint compression, making it appropriate for virtually any older adult, regardless of how severe the arthritis is. How to do it. Lie on your side with your hips stacked directly on top of each other. Bend both knees to approximately 45 degrees, keeping your feet together. Keep your pelvis completely still. This is the part most people get wrong. The pelvis should not roll backward during the movement. Slowly rotate your top knee upward, opening the legs like a clamshell, as far as you can go without the pelvis moving. Hold for 2 seconds at the top. Lower slowly. 3 sets of 15 repetitions on each side. You will likely feel this exercise immediately in the outer hip and buttock area. That burning sensation is the gluteus medius activating, possibly for the first time in years. Expect mild soreness the following day. That's the correct response. As you get stronger, progress by adding a light resistance band just above the knees. This small addition significantly increases the demand on the gluteus medius and accelerates strength gains. Movement number 3, the seated hip flexor stretch. The first 2 movements build strength. This one addresses the other half of the equation, flexibility and joint mobility. After 65, the hip flexors, the muscles at the front of the hip that lift the leg and allow you to sit down, become chronically shortened. This happens for a straightforward reason. Most older adults spend a significant portion of their day sitting. In a seated position, the hip flexors are in their shortened state for hours at a time. Over months and years, they adapt to that shortened length. The result is an anterior pelvic tilt. The pelvis tips forward, which compresses the back of the hip joint, reduces the range of motion available, and contributes directly to the grinding, deep hip pain that many people over 65 describe. Tight hip flexors also affect the knee. When the hip doesn't move through its full range, the knee compensates, rotating slightly inward with each step, increasing medial joint stress. How to do it. Sit on the edge of a firm chair. Slide one leg behind you so that the foot rests flat on the floor behind the chair with the knee pointing downward. Keep your back straight and your pelvis neutral. Do not arch the lower back. You should feel a gentle stretch at the very front of the hip of the back leg. Hold this position for 30 seconds. Breathe steadily. Switch sides. Repeat 3 times on each side. This is not a stretch you should feel in the knee or the lower back. If you do, adjust your position. Move the back foot slightly further behind you and make sure you are not arching the lumbar spine. The sensation should be entirely in the front of the hip, just below the hip bone.
Do this stretch every morning before you get up from your first seated position of the day, and again in the evening. Consistency over weeks produces a measurable change in pelvic position and hip range of motion.
Here are 3 additional things that directly support joint health after 65 and that work alongside these exercises. First, walking, not resting. The instinct when joints hurt is to move less. This is almost always the wrong approach. Cartilage has no blood supply. It receives nutrients through the compression and release of movement. Prolonged rest accelerates cartilage degradation. 30 minutes of walking daily, even slow walking, maintains the metabolic health of the joint and reduces inflammatory markers associated with osteoarthritis pain. Second, body weight matters more than most doctors say directly. Every pound of body weight translates to approximately 4 pounds of force on the knee joint during walking. A 10-pound reduction in body weight removes 40 pounds of force per step. For someone with moderate knee osteoarthritis, this is clinically significant. Even modest weight reduction, 5 to 10 pounds, produces measurable reductions in knee pain scores. Third, anti-inflammatory nutrition. Omega-3 fatty acids found in fatty fish, walnuts, and flaxseed have been shown in clinical trials to reduce joint inflammation and pain in osteoarthritis patients. Turmeric, specifically its active compound curcumin, has demonstrated comparable anti-inflammatory effects to low-dose ibuprofen in several studies, without the kidney and cardiovascular risks that make NSAIDs problematic after 65. These are not replacements for the exercises, they are amplifiers. Which of these 3 movements are you going to start with? Leave a comment below. I read every single one, and your experience might help someone else who's been living with this pain for years. If this was useful, share it with someone over 65 who is dealing with knee or hip pain. The information in this video could genuinely help them avoid a surgery they may not need. And if you're not subscribed yet, new videos every week focused entirely on health after 60. No ads, no products to sell. I'll see you in the next one.